Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome everyone. Today we will focus on how to evaluate a myocardial patient's health before oral surgery, which is very important in dental practice. Heart attack or myocardial infarctions happens when part of the heart muscle is damaged due to a lack of blood flow. This is often caused by a clot blocking a narrowed artery. The affected area of the heart muscle becomes non-functional and eventually necrotic. The surrounding tissue, which may still recover, becomes a hot spot for abnormal heart rhythms. When someone has a heart attack, initial treatments aim to lessen the heart workload, improve oxygen supply, and manage irregular heartbeats. If initial treatment do not work, more invasive option like angioplasty or coronary artery bypass, grafting, that is cabbage, or a pacemaker might be necessary. Before performing oral surgery on a patient who has had an MI, it's crucial to talk with their primary care physician. Major surgeries are typically delayed for at least 6 months to reduce the risk of another MI. However, with advancements in MI treatment and thrombolytic therapies, some procedures might be done sooner if the patient's physician agrees. Simple oral surgeries might be done within 6 months after MI if the patient is not too anxious and has recovered well. A medical consultation is needed to ensure it is safe. It is important to check patients' cardiovascular status and monitoring for any undiagnosed dysrhythmias or heart failure is crucial before proceeding. Patients with a history of MI use medications such as aspirin or other anticoagulants to prevent further coronary thrombosis. This factor might be carefully considered when planning surgery to avoid excessive bleeding. An anxiety reduction protocol should be employed to minimize stress. Additionally, having nitroglycerin on hand and using it prophylactically, if directed by the patient physician, is advisable. Using a local anesthetic containing epinephrine is safe for post-MI patient if administered in appropriate doses with careful aspiration to avoid intravascular injection. Monitoring the patient's vital signs throughout the procedure is crucial for ensuring their safety. Nitric oxide can be considered to further reduce anxiety during the surgery. This box outlines the essential steps for managing a patient with a history of myocardial infarction. These steps include consulting the primary care physician, checking for blood thinner use, reducing anxiety, ensuring effective local anesthesia, and monitoring vital signs. Complex cases may need a referral to an oral maxillofacial surgeon. Patients who have had coronary artery bypass grafting, that is cabbage, are managed similarly to those with MI. Major surgeries are usually postponed for 3 months to allow recovery, but routine dental procedures can be done sooner if the recovery is smooth and anxiety is minimal. To sum up, careful management is needed for patients with a history of myocardial infarction or cabbage when planning oral surgery. Consultation with patient's primary care physician is essential to determine the safest timing and approach for any oral surgery. Understanding the patient's medication regimen and using anxiety reduction protocols, appropriate anesthesia, and continuous monitoring ensures a safe and successful outcome. Cabbage patient needs similar care to MI patient with a specific timing for elective procedures to ensure they have recovered well and to minimize risks. Thank you. Wish you best of luck.